Moving and handling. Inserting a tubular slide sheet. To start, make sure the bed height is set to the shortest person. I'm going to push using my legs. My colleague is going to reach across and help the patient over onto their side. Ready, steady, roll. We get the patient onto their side. I'm going to lay the tubular sheet out. Watch where we place the tubular sheet. My colleague is going to help by placing one hand there and the other on top. On this side here, I'm rolling the sheet in. Rolling it on top like this. Now, I'm going to tuck the sheet under the patient. Gently roll the patient onto their back. At this point, we should be able to gently unroll the sheet from underneath the patient to prevent shearing on the body. Next, we'll demonstrate how to move the patient up the bed. I point my right toe to that corner, so my spine's straight, and then I push through my legs. Ready, steady, slide. Now we're going to show you from behind. With one leg stepped forward. Ready, steady, slide. Removing a tubular slide sheet. From underneath the pillow. I'm turning the slide sheet under like this, making sure there's no shearing against the patient. I'm using my body weight, instead of picking along using my wrists and my fingers. Inserting a tubular slide sheet, unroll technique. Lay the slide sheet over the patient's legs. I'm going to hold the sheet up, and then pinch along where it comes out of the packet, and then roll. So we've created a roll, like so. We're going to fix here under the head. Then we're going to come underneath and unroll so the shearing is inside. This comes up under the pillow like so. We don't want to twist our spine, so we're going to face up the bed. Slide your hand fully underneath. Ready, steady, pull, then repeat the process. When we're past the hips, we can just unroll the sheet. We can also use a short tubular sheet as a mitt. If the sheet gets stuck under the patient, we can push it underneath to smooth it out. Next, let's take a look from a different perspective. Start by rolling the tubular sheet. Flip the sheet over. Passing over to my colleague, and together we'll position it under the shoulders. Hold on to the top of the sheet, and place your hand right under. Ready, steady, pull. Then repeat the process. Rolling a patient onto their side. To begin, we're going to shift the patient towards one side of the bed to create enough space to roll them onto their side. Ready, steady, slide. Gently move the patient's leg up, like so. Place their near arm across their body. Ask the patient to turn their head, and ensure the patient's opposite arm is positioned out of the way. Then, I'm going to slide the patient over onto their side, like so. Let's switch angles so you can get a better look. Next, I'm going to reach underneath and grasp the bottom of the slide sheet. Turning the slide sheet back on itself, like so. This will allow the slide sheet to come out from underneath the patient. Protecting the patient when raising backrest. We're going to apply the same method we've used so far. Ready, steady, pull, but this time, we'll stop just before reaching the patient's lower back. Adjust the headrest to elevate the patient's upper body. You can assist the patient by gently rocking them from side to side as they are being lifted. This helps prevent any discomfort or the sensation of being squashed. Releasing tissue stress. We're going to put the mitt on and gently slide it under the patient. We can slide it under the back and around here, and so on. Or, if we don't have a mitt, we can use a slide sheet. We're just going to use it like a mitt, sliding it under the patient and down. Position it under the lumbar area and downwards to help with pressure relief.